This morning, a worrying sign in Seoul, building makeshift hospitals out of shipping containers. ICU beds are filling up with COVID patients, and new daily cases are closing in on an all-time high.
지금은 코로나19가
South Korean disaster officials calling it the country's greatest crisis since the start of the pandemic. Baseball stadiums are empty again. Restaurants told to close early. Paul Rader lives in Seoul with his family.
It's a little bit discouraging, I think, because, we have been pretty on top of things as far as the social distancing guidelines and mask wearing.
When I was there in May, the virus was virtually under control thanks to testing, tracking, and tracing, and putting visitors from abroad like me into strict 2-week quarantine. But across Asia, cases are now spiking in countries that manage the pandemic well. In South Korea, nearly 700 cases 3 days in a row, the highest since late February. In Japan, a new record high today of nearly 3,000 COVID infections. The virus also spreading in Hong Kong, Malaysia, Indonesia, Taiwan, and Vietnam. Cold weather and pandemic fatigue causing this new winter wave. People tired of wearing masks and staying home.
In the winter, because of low humidity, the virus will transmit easy. And also people tend to stay indoor. That also, facilitate the transmission.
Hong Kong partied in the streets on Halloween. Now schools are closed and they're lining up for tests. Officials pleading with people to stay home. In Japan, military nurses have been called in to help at struggling hospitals. Across Asia, they're tightening social distancing rules to avoid the economic pain of lockdowns and preparing for mass vaccinations. With the clock ticking on the Olympic Games, Japan wants the entire country vaccinated by next summer. In South Korea, this super cold warehouse used for tuna now emptied out, ready to store the Pfizer vaccine. But the government says the first doses won't arrive until March.
Now, Kelly, one of the big concerns there in Asia is that this wave, for some reason, appears to be harder to control than the past ones. What's going on?
Well, a couple of things are going on, Hoda. First of all, health officials, particularly in South Korea, say that this is not just one cluster that they can then trace and isolate. They're dealing, they say, with more of a widespread cases of the virus. And also, they're also seeing this in asymptomatic young people. They believe that these young people who don't have symptoms are going out, not abiding by some of these social distancing measures, and spreading the virus. Those asymptomatic cases are nearly impossible to track and trace. So this is what has health officials so worried. Also, Hoda, all of these countries, like so many countries, are trying to balance the health of the population and the health of the economy.
Yeah,
Hoda?
just like what's going on here. All right, Kelly Cobiella. Kelly, thanks.